Dehydration is a serious health concern that disproportionately affects our elderly population. Unlike younger adults, seniors face unique challenges when it comes to maintaining proper hydration levels. As we age, our bodies undergo several changes that increase the risk of becoming dehydrated. First and foremost, the sensation of thirst naturally diminishes with age. Many seniors simply don't feel thirsty even when their bodies need fluids. This reduced thirst response means they may not recognize when they need to drink water. Additionally, many medications commonly prescribed to older adults can contribute to fluid loss. Diuretics for high blood pressure, certain heart medications, and even some laxatives can increase urination or cause fluid loss through other means. Another significant factor is the fear of incontinence. Many seniors deliberately limit their fluid intake because they worry about bathroom accidents or having to make frequent trips to the toilet, especially at night or when away from home. These factors combine to make dehydration one of the most common reasons for hospitalization among the elderly population. The consequences can be severe, affecting everything from cognitive function to kidney health. Understanding the signs and addressing the unique challenges of hydration in seniors is essential for maintaining their overall health and quality of life. Early warning signs of dehydration in seniors. Dehydration in the elderly population is a serious concern that demands immediate attention. The early warning signs of dehydration can be subtle and easily overlooked, making it crucial for caregivers, family members, and seniors themselves to become familiar with these indicators. Recognizing these signs promptly can prevent the progression to severe dehydration, which may require hospitalization and can lead to serious complications. This comprehensive overview explores the early warning signs of dehydration in seniors, examining each symptom in detail and explaining why they occur in the aging body. Dry mouth, lips, and tongue. One of the earliest and most noticeable signs of dehydration is dryness in the mouth, lips, and tongue. The mucous membranes in the mouth are highly responsive to hydration levels in the body. When fluid intake is insufficient, these membranes become less moist and begin to dry out. Seniors may report a persistent feeling of dryness or stickiness in their mouth that doesn't improve after drinking small amounts of water. The appearance of the tongue often changes as well, becoming dry and taking on a rougher texture. The normal moisture that coats the tongue diminishes, making it appear duller and sometimes even developing a whitish coating. The lips may become chapped, cracked, or flaky due to lack of moisture. These cracks can be painful and may even bleed in severe cases. What makes this symptom particularly relevant for seniors is that many older adults already experience dry mouth, xerostomia, as a side effect of medications or age-related changes in salivary gland function. This pre-existing condition can mask dehydration or make it harder to identify based on mouth dryness alone. However, a sudden increase in mouth dryness should always be investigated as a potential sign of dehydration. For those with dentures, dehydration can make wearing them more uncomfortable as the reduced saliva production affects the natural suction that helps keep dentures in place. The combination of dry mouth and denture discomfort can further discourage seniors from eating or drinking properly, creating a dangerous cycle that exacerbates dehydration. Dark yellow urine or reduced urination. Changes in urine color and frequency represent another critical early warning sign of dehydration. When properly hydrated, urine should be a pale straw color or light yellow. As dehydration sets in, the kidneys work to conserve water by concentrating the urine, resulting in a darker yellow or amber color. In severe cases, urine may even appear orange-brown. Beyond color changes, dehydration typically causes a reduction in urine output. Seniors may notice they're urinating less frequently than usual. While a healthy adult might urinate 4 to 7 times daily, a dehydrated person might go only 2 to 3 times. This reduction occurs because the kidneys are retaining more water in response to decreased fluid intake. For seniors, this warning sign can be complicated by several factors. Many older adults take medications that affect urine color or frequency, such as certain vitamins that darken urine or diuretics that increase urination. Additionally, some seniors with urinary incontinence may not pay close attention to their urine characteristics or may deliberately restrict fluid intake to avoid accidents, making this sign less reliable. It's worth noting that seniors with diabetes may experience increased urination despite being dehydrated, as high blood sugar levels can override the body's water conservation mechanisms. This makes monitoring urine color particularly important for diabetic seniors. Headaches and dizziness. Headaches and dizziness represent neurological symptoms of early dehydration that can significantly impact a senior's daily functioning and quality of life. These symptoms occur because even mild dehydration reduces blood volume, which in turn decreases blood flow to the brain and causes blood vessels in the brain to temporarily narrow. The headaches associated with dehydration often present as dull, throbbing pain that may worsen when standing, walking, or engaging in physical activity. They frequently affect the entire head rather than being localized to one area. For many seniors, these headaches may be mistaken for tension headaches or attributed to other health conditions. Dizziness from dehydration typically manifests as lightheadedness or a feeling of unsteadiness. This occurs because reduced blood volume leads to lower blood pressure, especially when changing positions, a phenomenon known as orthostatic hypotension. A senior might feel fine while sitting but experience dizziness or even near fainting when standing up. For elderly individuals, these symptoms are particularly concerning because they significantly increase fall risk. Falls represent one of the most serious health threats for seniors, potentially resulting in fractures, head injuries, and loss of independence. A dehydration-related fall can trigger a cascade of health problems that extend far beyond the initial dehydration. The cognitive effects of dehydration can compound these physical symptoms. Even mild dehydration can affect concentration and cognitive function, making seniors less aware of their surroundings and less able to compensate for feelings of dizziness or unsteadiness. Unusual fatigue or lethargy. Unexplained tiredness or a sudden lack of energy often signals the body's response to insufficient hydration. When the body lacks adequate fluid, blood volume decreases, forcing the heart to work harder to pump oxygen and nutrients to cells throughout the body. This increased cardiac workload manifests as fatigue and reduced energy levels. For seniors, distinguishing dehydration-related fatigue from other causes can be challenging. Many older adults experience fatigue due to medication side effects, sleep disturbances, depression, or chronic health conditions. However, dehydration-related fatigue typically has a more sudden onset and may improve relatively quickly after proper rehydration. This fatigue can present as both physical and mental exhaustion. Physically, seniors may find everyday tasks more demanding, experiencing muscle weakness and reduced stamina. Mentally, they may struggle with concentration, feel unmotivated, or find decision-making more difficult than usual. The impact of this symptom on quality of life shouldn't be underestimated. Fatigue can limit a senior's ability to engage in social activities, exercise, or maintain independence with daily tasks. For those living alone, severe fatigue might prevent them from preparing meals or taking medications properly, creating a dangerous cycle where dehydration worsens because the person is too tired to address it effectively. Muscle cramps, particularly in legs. Muscle cramps, especially in the legs, often serve as an early indicator of dehydration in seniors. These painful, involuntary muscle contractions occur because proper muscle function depends on a delicate balance of electrolytes, particularly sodium, potassium, and calcium, which becomes disrupted when fluid levels are insufficient. When dehydrated, the concentration of electrolytes in the body increases as water levels decrease. This imbalance affects nerve function and muscle contraction mechanisms, leading to cramping. The leg muscles are particularly susceptible because they're larger muscle groups that are frequently used throughout the day. For seniors, dehydration-related muscle cramps typically occur in the calves, thighs, or feet. These cramps can be excruciating and may wake them from sleep. Nocturnal cramps. What distinguishes dehydration-related cramps from other types is their increased frequency and intensity during periods of inadequate fluid intake. The risk of muscle cramps is heightened in seniors who take certain medications, particularly diuretics, which increase fluid and electrolyte loss. Additionally, older adults who engage in physical activity without proper hydration are at greater risk, as sweating further depletes the body's fluid reserves. Beyond the immediate pain, these cramps can contribute to mobility issues and fear of movement in seniors. An older adult who experiences painful cramps may become reluctant to walk or exercise, leading to a cycle of decreased activity, reduced muscle strength, and greater fall risk. Dry, cool skin with reduced elasticity. Changes in skin appearance and texture provide visible evidence of dehydration that caregivers and healthcare providers can readily observe. In the dehydrated state, the skin often becomes dry, cool to the touch, and loses its normal elasticity or bounce-back quality. The scientific term for this reduced skin elasticity is decreased skin turgor, which can be assessed through a simple test, gently pinching the skin on the back of the hand, lower arm, or abdomen and observing how quickly it returns to its normal position. In a well-hydrated person, the skin rapidly snaps back. In someone experiencing dehydration, the skin returns to position more slowly and may temporarily remain tented. For seniors, skin assessment requires special consideration. Age-related changes in skin, including natural loss of elasticity and thinning, can mimic dehydration symptoms or make the skin turgor test less reliable. Areas with less subcutaneous fat, such as the forehead, sternum, or inner thigh, may provide more accurate assessments in the elderly. Beyond elasticity, dehydrated skin in seniors often develops a dull, flaky appearance. Fine lines and wrinkles become more pronounced as the skin cells lose moisture, and dry patches may appear, particularly on extremities. The skin may feel rough or papery to the touch. Temperature changes can also occur. Dehydrated skin often feels cooler than normal, especially in the extremities, as the body reduces peripheral circulation to conserve resources. This cooling effect can make seniors feel cold even in warm environments. Confusion or increased irritability. Cognitive and mood changes represent subtle but significant early warning signs of dehydration in the elderly. Even mild dehydration can affect brain function, as the brain is particularly sensitive to changes in fluid balance and blood flow. Confusion may manifest as disorientation about time or place, difficulty following conversations or instructions, or problems with short-term memory. Family members might notice their loved one asking repetitive questions, struggling to complete familiar tasks, or becoming disoriented in familiar environments. Irritability is another common psychological symptom of early dehydration. Seniors may display uncharacteristic impatience, increased sensitivity to noise or disturbances, or general crankiness that isn't typical of their usual demeanor. This irritability stems from both the physical discomfort of dehydration and its direct effects on brain function. For seniors with pre-existing cognitive impairments such as dementia, dehydration can trigger a marked worsening of symptoms. What might normally be mild confusion can escalate to significant disorientation, agitation, or even hallucinations when compounded by dehydration. These cognitive and mood changes are particularly concerning because they can create a self-perpetuating cycle. A confused or irritable senior may be less likely to remember to drink fluids or may resist caregivers' attempts to encourage hydration, thereby worsening their condition. The importance of early recognition. Recognizing the early warning signs of dehydration in seniors is crucial because the condition can escalate rapidly. The body's compensatory mechanisms become less effective with age, and the progression from mild to severe dehydration can occur more quickly in older adults compared to younger populations. For family members and caregivers, establishing a routine for monitoring hydration status is important. Regular checks for dry mouth, observations of urine color, and awareness of energy levels can help identify dehydration before it becomes severe. Simple interventions, such as offering fluids regularly, can prevent serious complications. Healthcare providers play a vital role in educating seniors about personalized hydration needs and helping them develop strategies to maintain proper fluid intake despite age-related challenges. Regular weighing can also help detect fluid loss, as sudden weight decreases may indicate dehydration. The consequences of overlooking these early warning signs can be severe, potentially leading to urinary tract infections, kidney problems, blood clots, or even more life-threatening conditions such as heat stroke or severe electrolyte imbalances requiring hospitalization. By understanding and responding promptly to these early warning signs, caregivers and healthcare providers can help seniors maintain proper hydration, supporting their overall health and quality of life while preventing the significant complications associated with dehydration. Prevention strategies for dehydration in seniors. Preventing dehydration in the elderly requires a multifaceted approach that addresses the unique physiological, psychological, and practical challenges seniors face in maintaining adequate hydration. With thoughtful planning and consistent implementation, caregivers and seniors themselves can significantly reduce dehydration risk. The following prevention strategies provide comprehensive guidance for keeping seniors properly hydrated and healthy. Setting reminders to drink regularly. For many seniors, especially those experiencing cognitive changes or simply adjusting to a less structured lifestyle after retirement, remembering to drink regularly throughout the day can be challenging. Implementing a consistent reminder system can overcome this hurdle effectively. Digital reminders offer versatile options for seniors comfortable with technology. Smartphone alarm apps can be programmed to sound at regular intervals throughout the day, typically every 1 to 2 hours during waking hours. Smart speakers can be set up to announce hydration reminders, and some smartwatches now include hydration tracking features that notify the wearer when it's time to drink. For those who prefer non-digital solutions, visual cues work well. Placing a large, visible water bottle or cup in frequently visited areas of the home serves as a constant reminder. Some caregivers find success with specially designed water bottles that mark time intervals, showing how much should be consumed by certain hours of the day. Linking hydration to existing routines creates natural reminders. Encouraging seniors to drink a full glass of water with each medication, before and after each meal, upon waking, and before bed establishes consistent hydration habits that work with established patterns rather than requiring new ones. For seniors receiving care from family members or professional caregivers, verbal reminders and gentle encouragement make a significant difference. Caregivers should approach hydration as a priority during their visits, offering fluids and ensuring the senior drinks adequately while they're present. Making water accessible throughout the home. Physical accessibility of beverages represents a crucial factor in preventing dehydration. Many seniors experience mobility limitations that make frequent trips to the kitchen difficult or risky. Strategic placement of hydrating beverages throughout the living environment removes this barrier effectively. Placing filled water bottles or cups in every room the senior frequently uses ensures that hydration is never more than an arm's reach away. Special attention should be paid to bedside tables, favorite chairs, television viewing areas, and any space where the senior spends significant time. The type of container used matters significantly. For those with arthritis or reduced grip strength, lightweight cups with handles or bottles with easy open caps prevent frustration. Insulated containers keep beverages at preferred temperatures longer, encouraging consumption. Spill-proof options provide confidence for those with slight tremors or concerns about accidents. For seniors with more significant mobility challenges, installing small beverage refrigerators in accessible locations throughout the home may be worthwhile. This allows them to refill their own drinks without navigating to the kitchen. Similarly, water dispensers with room temperature water can provide easy access without the need to lift heavy pitchers or water bottles. During hot weather or when the heating system is running, accessibility becomes even more critical. Dehydration risk increases significantly during these times, making it essential that seniors have constant, easy access to fluids regardless of where they are in the home. Flavoring water naturally to encourage consumption. Many seniors find plain water unappealing, leading to inadequate intake despite understanding its importance. Adding natural flavors transforms ordinary water into a more enticing beverage without adding significant calories or artificial ingredients. Fresh fruit infusions offer endless variety. Slices of citrus fruits like lemon, lime, or orange add refreshing flavor and small amounts of vitamin C. Berries, including strawberries, blueberries, or raspberries, provide subtle sweetness and antioxidants. Cucumber slices with mint leaves create a spa-like refreshment, particularly welcome during warmer months. Herbs can transform water dramatically while providing additional health benefits. Mint, basil, rosemary, or lemongrass add aromatic qualities that make water more interesting. For seniors who enjoy warming beverages, caffeine-free herbal teas, served hot or cold, contribute to hydration while providing comforting flavors. For those who prefer slightly sweetened beverages, a small splash of 100% fruit juice added to water creates flavor without excessive sugar. This approach provides the familiar sweetness many seniors enjoy while maintaining a primarily water-based beverage. Many seniors find that serving temperature significantly affects their willingness to consume water. Some prefer room temperature water, as very cold beverages can cause dental sensitivity or digestive discomfort. Others find cold water more refreshing and are more likely to drink adequate amounts when it's well chilled. Eating hydrating foods. Food sources of fluid represent an often overlooked hydration strategy, particularly valuable for seniors with reduced thirst sensation. Many fruits and vegetables contain high percentages of water, contributing significantly to overall fluid intake while providing essential nutrients. Watermelon, strawberries, cantaloupe, and peaches consist of more than 90% water, making them excellent hydrating snack options. These fruits also provide natural sweetness that appeals to many seniors, increasing the likelihood of regular consumption. Cucumbers, lettuce, celery, and tomatoes similarly offer high water content in versatile forms that can be incorporated into meals and snacks. Soup-based meals provide substantial hydration, particularly valuable during cooler months when cold beverages may seem less appealing. Clear broths, vegetable soups, and even cream-based soups, in appropriate portions for those watching calories, contribute significant fluid while providing satisfying nutrition. Gelatin desserts, particularly those made with fruit juice rather than artificial sweeteners, provide an enjoyable way to increase fluid intake. These semi-solid treats may be especially appropriate for seniors with mild swallowing difficulties who need thickened liquids. Yogurt, cottage cheese, and similar dairy products contain substantial water content while providing calcium and protein important for senior health. When incorporated into daily meal plans, these foods contribute meaningfully to overall hydration status. Using adaptive cups for those with grip issues. Physical limitations that make standard drinking vessels difficult to handle can significantly impact hydration status. Fortunately, numerous adaptive drinking devices have been developed specifically to address these challenges. Two-handled cups provide stability for those with tremors or weakness in their hands. The dual handles allow for a more secure grip using both hands if necessary. These cups come in various materials, including lightweight plastic for those who struggle with heavier vessels. Straws, particularly those with one-way valves, reduce the effort required to drink and minimize spill risk. Weighted straws stay in place in the cup, eliminating frustration with floating or falling straws. For seniors with limited neck mobility, flexible straws can be positioned for comfortable drinking without awkward positioning. Cup holders and stabilizers attach to walkers, wheelchairs, or furniture, keeping beverages secure and accessible without requiring constant handling. These devices reduce spill anxiety and ensure drinks remain within easy reach. For those with more significant hand weakness or coordination issues, specialized cups with built-in straws or spouts similar to sports bottles may work best. These eliminate the need to tip the cup, reducing spill risk and making the drinking process more manageable. Monitoring medication effects. Many medications commonly prescribed to seniors affect fluid balance, making medication monitoring an essential component of dehydration prevention. Understanding these effects allows for proactive hydration strategies tailored to specific medication regimens. Diuretics, often prescribed for high blood pressure or heart conditions, increase urination and can rapidly lead to fluid loss. Seniors taking these medications require higher fluid intake than average and may benefit from specific hydration schedules coordinated around medication timing. Certain pain medications, particularly opioids, can cause dry mouth while simultaneously reducing thirst sensation. This dangerous combination increases dehydration risk substantially. For seniors taking these medications, scheduled fluid intake rather than relying on thirst becomes essential. Some psychiatric medications, including certain antipsychotics and antidepressants, affect temperature regulation and can increase sweating, leading to greater fluid loss. During warmer weather, seniors taking these medications need particularly careful hydration monitoring. Laxatives, frequently used by seniors experiencing constipation, can cause significant fluid loss through the digestive system. When these medications are necessary, increased fluid intake must accompany their use to prevent dehydration. Regular medication reviews with healthcare providers should include discussion of hydration implications. In some cases, medication timing can be adjusted to minimize dehydration risk, or alternative medications with fewer fluid-related side effects might be appropriate. Involving caregivers in hydration monitoring. Professional caregivers, family members, and friends play crucial roles in preventing dehydration among seniors. Their observational skills and consistent presence provide valuable monitoring that many seniors cannot maintain independently. Training caregivers to recognize early dehydration signs ensures timely intervention. All individuals involved in senior care should understand the symptoms discussed earlier and know appropriate responses when these symptoms appear. Regular training refreshers maintain awareness of this critical health issue. Implementing hydration logs creates accountability and provides important data for healthcare providers. Simple charts recording beverage consumption throughout the day help identify patterns and ensure adequate intake. These logs become particularly valuable when multiple caregivers share responsibilities. For professional care environments, hydration protocols should establish standard practices for offering fluids, monitoring intake, and responding to refusals. Regular hydration rounds, similar to medication rounds, prioritize this essential aspect of care. Family caregivers benefit from establishing regular hydration routines when visiting loved ones. Starting each visit by offering a beverage and ensuring it's consumed sets a positive pattern while providing opportunity to observe hydration status. Through these comprehensive strategies, caregivers and seniors themselves can significantly reduce dehydration risk, preventing the serious health consequences associated with insufficient fluid intake. Regular, consistent attention to hydration needs represents an essential component of senior health maintenance and quality of life preservation.